Welcome to Taking Healthcare by Storm Industry Insights, the podcast that delves into the captivating intersection of innovation, science, compassion, and care. In each episode, Quality Insights Medical Director Dr. Jean Storm will have the privilege of engaging with leading experts across diverse fields, including dietitians, pharmacists, and brave patients navigating their own healthcare journeys. Our mission is to bring you the best healthcare insights, drawing from the expertise of professionals across West Virginia, Pennsylvania, and the nation. Subscribe now, and together we can take healthcare by storm.
Hi, everyone. Welcome to another episode of Taking Healthcare by Storm. I am Dr. Jean Storm, the medical director here at Quality Insights. And today we're going to be exploring the intersection of patient advocacy, innovation, and the power of questioning the expected path in healthcare, something I am deeply interested in. And I think many of you out there will find this interesting as well. My guest is Jack Clifford. So he's faced with a life-threatening diagnosis, 100% blocked LAD artery, which it's left anterior descending artery. And this is often referred to as the widowmaker, as when this artery becomes blocked and you have a heart attack as a result, you often don't survive or it's pretty catastrophic. So he was advised to undergo immediate bypass surgery, which is often advised as a treatment, but instead he made a decision that many will find difficult. He paused, which is, I think, oftentimes the best approach. He asked questions, and he ultimately pursued a non-invasive therapy called EECP, and we're going to be talking about that today. What followed is not just a story of survival, but one of resilience, curiosity, and a commitment in helping other patients navigate complex health decisions. Jack is now the founder of EECPlocator.com, a resource designed to connect patients with EECP providers across North America. So we're going to be talking about courage, the patient experience, and what happens when individuals take an active role in their care, which patients always should be. Jack, thank you so very much for joining us today.
Yeah, my pleasure, Gene. Super excited to be here.
Yeah, I would love to start with your journey. And I know we're going to be talking about what happened to you and what led you to this passion with EECP. But I want to start with your journey. How did your military service shape who you are today? And how did that ultimately lead you to the work you're doing now in patient advocacy and cardiovascular health?
That's interesting. Yeah. So I joined the military when I was 17. So in many ways, I was raised up in the military because didn't retire until I was 39. And just in order to be successful in the military, even though it might seem a little counterintuitive, you have to learn how to investigate problems at a really deep level and sometimes just not take no for an answer, even though there's a right and a wrong way to do that. Just, I suppose, like there is in healthcare, where you can be persistent and challenge the system and do it in a way that does not necessarily alienate yourself to everyone at the same time. And so I think in order to be successful in the military, which I certainly was, I made it to E9 in just 17 years, which is pretty unique. You have to be willing to give a lot of pushback to various things, but again, do it in the right way, which again, I think translates to that world of challenging healthcare to really get the best outcome for yourself or whoever you're advocating for.
Yeah, I love that. Stand up for yourself, which, yeah, sometimes I think, in healthcare, that's a very challenging thing, most definitely. I described in the introduction that you were diagnosed with 100% blocked left anterior descending or LAD artery, and you were told you need to have bypass surgery, which is pretty serious. They just open up your chest and try to do a bypass with a vein around that blocked area. So can you walk us through that moment when you were diagnosed, and what was going through your mind when you were given that recommendation?
Yeah, it was No, it was really over a series of, about a day and a half, I suppose. And it wasn't just, I mean, yeah, the LED was 100% blocked, but I was 95 on the left and I was 80 on the right. And my nuclear stress test was one of the worst they'd ever seen. The doc who gave it, I later found out he personally said it was the worst he's ever seen. And he was a pretty old doc that had been doing that a long time. But anyhow, that was, at 47, a pretty young age. And so, yeah, I got to the hospital. It was the day after Christmas, which was a Friday. This was 5 years ago. And I ended up getting admitted. Had the weekend to think about it, which is really fortunate because they weren't going to do the heart cath until Monday. But the outcome was fairly certain. So they did end up I got the measurements, just to be clear, at a different hospital about 2 weeks later. They had a heart cath. But I did it at a hospital that didn't do bypass surgery, so that wasn't a risk. And I was really facing that risk, like the consent forms they wanted me to sign and everything. And my conversations with the doc were really like, yeah, we're going to go do a heart cath. But, in my mind, I'm like, well, based on everything that we're seeing and a little bit I know, and some questions I asked a few folks, like, I'm going to wake up having had my chest cracked up. And for me, it's not a small thing for anybody, but I saw my mom go through it 5 years before that. And then I saw her condition just start to decline steadily until today she's in a memory care unit. For anybody who doesn't know, that just means she's in a nursing home, but the part where everybody's brain is gone. Bypass surgery to me just felt like an unacceptable risk until I had tried everything else, because I felt okay. I wasn't in crisis. They acted like I was in crisis. I had a nitro patch on, which I didn't need, like a big glob of it on my chest. I had all these machines beeping around me, up to different things all weekend long, but I felt fine. And those machines were not doing anything for me. I didn't need the nitro, big patch on my chest. I'm sitting there like I had just been in a car crash or something. It was okay. There was no immediate crisis. So that was what was going on through my mind, was I wanted to try everything else before I subjected myself to something that I personally felt like had a level of risk that wasn't really being explained to me by anyone else.
That's amazing that you had that pause to do that, because it's scary, right? When there's all this stuff going on. Yeah. Yeah. And many people would just blindly follow that recommendation to undergo bypass surgery, not question it, and say, this is what I got to do.
Yeah.
So how did you find the courage to step back and do your own research and then ultimately pursue a completely different path with EECP? And I'm going to ask you to explain EECP, but I'm very, as a clinician and as someone that teaches other providers, I'm always interested in that moment when you have the courage. Yeah. So I'm curious about that.
Yeah, I appreciate you asking that specifically. So I like to call myself a master level biohacker, and it's not like there's a biohacker school, but my wife, who's a nurse with her doctorate in nursing and, a pretty seasoned healthcare person herself, but she's faced a series of medical issues that doctors didn't have answers for. And so that dates back to 2008. So with each thing that she ended up having, in each instance, there was 3 specific things that were, all 3 of them were catastrophic. Doctors had no answers, and we had to sort of biohack our way out of it, for lack of a better word. Maybe biohacking isn't the best word for it, but we had to find the answers. And we did in all 3 cases. And so harking back to 5 years ago, when it's my turn to have a health issue, and I'm kind of like, well, geez, like there was all these other situations where there were other answers than the one being presented, which is terrible. So perhaps with cardiac issues, there's other answers. I hadn't looked into it to the level that I knew about some of these other things, but I just knew there often are other answers. And I didn't know why we weren't presented with the other answers for my wife, but that's why in my head, we got to try everything else, because perhaps there is something else out there. And of course there was, but at that time I did not. I wasn't certain.
Yeah, I mean, that's really scary. And so it's for listeners who might not be familiar, can you explain what EECP is and what it stands for, how it works, and what is it like from a patient perspective?
Yeah, that's really amazing. It stands for Enhanced External Counterpulsation. And if you look into it, you may also just hear it called external counterpulsation. The enhanced is just a trademark term from one of the manufacturers that kind of just stuck, for lack of a better word. So they call it EECP, external counterpulsation. It is, functionally, it's a bed you lie in, and it has the compressors, and you are hooked up to a 3-lead EKG. So 3 leads on your chest and into your shoulders. And then you have cuffs that wrap around your calves, your thighs, and your hips. And then the machine detects your heartbeat, and in between your heartbeats, those cuffs inflate with air. And when you're lying there, it feels you feel kind of trapped because, these cuffs are all cinched up into you, and they got to be cinched up into your groin area. But it's not that big of a deal. You're just lying in bed comfortably. It's a comfortable bed. You can have a pillow if you want. And the machine starts to inflate and deflate, and you just lie there. You don't got to really do anything at all. The starting pressure of the machine is around 1.3 pounds per square inch. And then it goes all the way up to 6 pounds per square inch. And 1.3 doesn't feel like a lot. 6 feels like a lot. You kind of graduate into that pressure if you're doing it right. So that can be over a series of sessions or possibly just one session. Depends on how your body reacts to that pressure. But what feels like a lot of pressure at the beginning doesn't, once your body gets used to it. And that happens within seconds to minutes, sometimes longer. But anyhow, what it's functionally doing is it's pushing all the blood from not all the blood, but a large amount of blood from your lower body into your upper body. And that's forcing that blood through a bunch of small vessels in your vascular system that haven't had that level of blood flow going through them. There's a phenomenon called shear stress that happens in reaction to that. So you're inducing a lot of shear stress throughout your vascular system. But the easiest way to think about EECP is that it simulates cardiovascular exercise while you're lying comfortably in a bed. And I like to say, while the machine is pulsing to the beat of your heart, because it can be very relaxed and it's almost hypnotic in its own way. Just like exercise, I think everybody is pretty familiar with starting to do something that felt hard physically. And then over time, you do it more and it gets easier and easier. And then you got out the intensity because it's so easy after a certain amount of time. And, that's the exercise phenomenon. EECP works just like that. Doing it at a level that's super physiologic. So it's levels that a human can't perform on their own. It doesn't matter how fit you are. You just can't replicate that any other way. And that's the phenomenon. I can certainly go into a lot of detail about how the body responds to it, what it tends to work for, and so on and so forth.
I think it's very interesting. And I think maybe many people appreciated that you said it's actually relaxing. So, yes. So you mentioned your wife a little bit, and you've had the experience of caring for your wife. So how did that chapter of your life influence your passion for EECP and ultimately led you to create EECPlocator.com?
Yeah, thank you. I saw my wife benefit incredibly from the machine, so there's that. But I've seen lots of people benefit from the machine, and I guess I just get an intense amount of satisfaction from seeing people get better. And, seeing people reach their goals and their dreams. And if I can be some small part of that, that gives me a deep level of satisfaction. So however we get there, we get there. But with EECP, it has the potential to just profoundly change someone's health status in ways I could go on a diatribe for hours, but I still wouldn't have said enough as far as I'm concerned. But, like every time I tell somebody, it's like, they're like, EECP what? It doesn't matter if you're a doctor or a patient or whatever. Everybody's like EECP what? Cardiologists are like EECP what? The whole thing is crazy as far as I'm concerned. And my book really details the why at a kind of a pretty intricate and involved level. So if anybody's interested, that's fine. I'm not trying to sell books. But at the end of the day, like the fact that this thing does all of the amazing things that it does, and then everyone's like EECP what is just crazy. And we have to get to the other side of that. But there are specific reasons why. There's a lot of institutional reasons why, but there's also just functional logistical reasons why. EECP, a full course of therapy, requires 35 hours on a machine. Right now, we have around 150 providers in the United States. If you live more than 30 minutes away from somewhere you have to go 35 times in a row within a 7-week period, then in reality, you're probably not going to do it. In my case, I drove 3 hours, stayed in a hotel Monday through Friday, over and over again until, fortunately, I got my own machine, which is a whole other conversation we can have. But the ask of getting somewhere 35 times is just a lot over a 7-week period. And so, this amazing therapy is practically invisible because no one can get somewhere where the machines are. If you happen to just luck out and live down the street from one, then great. But that's pretty unlikely. More than, I think I am estimating, well over 70% of the folks in the United States live more than 30 minutes away from an access point for EECP.
That's crazy. Yeah. So it's FDA approved. It's been around for a long time. Yet many clinicians, including me, and patients are unfamiliar with it. So why do you think EECP remains underutilized in the United States?
Okay, so institutionally, the first reason is because it grew up in the cardiac space. And so cardiologists, they got excited about it. There was upwards in 2,000 centers at one point. I don't know the exact number on that. I can't find it. But in the early 2000s, everybody was getting excited about this therapy, at least in the cardiology space. And Medicare approved it for treating angina. That was in the class 3-4 range. So when you're really having trouble, even like around your house and whatnot. But I think there was a lot of hope that it would get approved for even less strenuous indications in the cardiac space. And cardiologists were buying machines and people were using them and people were excited. And there was increasingly more studies in the US. And then Medicare kind of deflated that balloon when there was a study for heart failure. And it was it was a decent study. The results were still positive. It wasn't a super well-designed study, but for whatever reason, Medicare was like, no. A really good read is to go to the comments section of that decision on CMS, the Center for Medicaid Services website, because there's like several hundred EECP providers who comment and are like, you're not going to cover this? Here's my experience treating patients. And it's a crazy read. And that's from 2006. So around that same time, drug-eluting stents became like way better than the previous version of stents. Had a lot of complications. So stenting became a better process on the patients, and more and more cath labs started popping up out of the middle of nowhere, and more hospitals started creating heart centers, and it's a giant revenue source. And ECP is like a 35-hour protocol might cost you $5,000, probably somewhere between $3,000 and $7,000. But a physician can make $10,000 on a stent in 2 hours. They're going to tie up a patient room 35 times for an hour and make what they can make in 2 hours. There's no low incentive. And there's never going to be, it's just the nature of things, but it doesn't change the realities. And here's the funny thing, EECP could possibly be, and I can't say for sure it is, but if it's in the ballpark of things, the most well-researched medical device on the planet. So this is not for a lack of data validating the kind of things that I'm saying are true. They're true. That's not rude. Some of it's debatable. Some of the things I think about ECP are debatable. Some of them are not. How it works on angina and heart failure, that's not debatable at all. It's just, you can't debate that. The research has already put that to. So it's an awareness issue and an access issue.
Yeah, and that can be fixed, right?
Yes,
I mean,
it's really fixed. So here's a little tidbit I'd love your audience to know. If you read the FDA indication that approved EECP machines in 2015 and forward, and I think there's been about 6 approvals since then, it says approved for use in angina and heart failure, and I think acute cardiac shock or something. So all these cardiac indications. And then it says approved for general circulation use, and at least in one instance, it says NVO2 max increase in healthy patients. And so, like, where I'm going with that is, yeah, it's medical, but it can kind of move from the medical to the wellness space if you think about it from a, hey, I'm just trying to improve my circulation generally perspective. And that lowers the bar for people to offer this to folks, right? And I'm not trying to take things away from doctors. I think they can and they should, and they can bill insurance for it and make a decent money that way too and help their patients. But what I care about is access points. I want people to be able to get this therapy into their lives. I want other people in my life that I can relate to that have had my similar experience.
Yeah, people that just not necessarily that they need to not get bypass surgery, but just have an option, right?
Yes. Just think about it. I mean, do bypass if you want to. This works great with everything. There's really nothing that I can think of that wouldn't work better if you threw EECP into the mix.
Well, that's perfect because I want to explore that. It's because EECP is being used for other conditions. So what are those conditions? And then why do you think this therapy does have potential across multiple clinical areas?
Oh my goodness. Okay, yes. So let's start with dementia. Dementia was studied in 2023 by first author, Dr. Moriarty. Wonderful man. I had a really great conversation with him, and he's out of Kansas University Medical's there. It was like 100 patients in the treatment arm and like 100 in the sham, roughly. And, in a demented patient, a year is a lot of time for progression of disease. You should definitely see a serious progression in a year in a dementia patient's life. And these are mild cognitive impairment. I should be clearing full dementia. But anyhow, they all got better. The diabetics got way better. And that says to me, like, hey, if you continued with the therapy, maybe your brain would come completely back. Who knows? But at least you weren't getting worse. So that says we can stop the progression. Now that's dementia. The long COVID been really well studied for long COVID, like 80% success rate over a couple of different studies recent. And I'm only citing US studies. Let's talk about China. This therapy has been in China for a long time, well before it's been in the US. It was jointly developed between the US and Chinese scientists in the US, and then Chinese scientists took it back to China and innovated on it. The US kind of did a little bit and stopped. And so there's like 5,000 access points in China. They use it for all kinds of things. It's part of the standard of care for any kind of cardiac treatment in like their normal conventional dogma. So long COVID, erectile dysfunction, honestly, any pelvic anything, like it works amazing in the bellows because when the blood gets pushed by the machine up to your upper body, that blood has to return to your lower body, but it gets trapped by that second subsequent wave right in your pelvis. And so the blood flow increased to your heart, maybe it's like 120%. Your brain might be same neighborhood. It's like 200, 250 to the pelvis. It's like crazy. Anyhow, kidney disease. Like, I swear that I believe that if you were heading towards having to be on dialysis, that EECP could stop you from ever having to go on dialysis. That's my firm conviction. I'd love to study that, but wouldn't you rather deal with an EECP machine that you could have in your house and keep your kidneys working as well as they can, start to improve them some instead of slipping down that slope of dialysis?
Oh, absolutely. Absolutely.
The reasons are, it's well documented to release a significant increase in hematopoietic stem cells. It's well documented to increase vascular endothelial growth factor. It's well documented to increase nitric oxide in the endothelium, inner lining of the blood vessels. It's well documented to reduce inflammation systemically. I could go on and on. Stroke recovery is another area. Stroke prevention, of course, but stroke recovery. It works because a lot of aging is about reduced blood flow. I'm sure you know this as a doctor. Like, we age. These other people running around with all these stem cells going through their body and everything repairing really quickly. It's about how it gets there in many ways. And once you have reduced blood flow, things just can't get to where they need to be.
Yeah. Yeah. So blood flow is the key, right? If we don't have blood flow, we're not living. So it's important. The last question, I love this question. I ask almost every guest. If you were in charge of healthcare in the United States, what is the first change that you would make to improve care and access to treatments like EECP?
It's a change. I'm trying to think to whether it's systemic or something I can just wiggle on. But I would really focus on getting the cost of EECP down and encourage reimbursement. Like, we're working right now to we're actually really petitioning the government through our Congress people and also some self-insurers and some other areas where we think we might have a willing ear to get an indication for endothelial dysfunction. If we had a diagnosis code of endothelial dysfunction, there's already an ICD code for billing on EECP. We could get insurance to pay for like preventative care related to all of these things that we label as heart disease, stroke, diabetes, whatever, that have a giant blood flow component to them. And if we could treat endothelial dysfunction, which EECP clearly treats, that's not really debatable from the scientific literature, then I think we could change the disease status of this entire country, like massively and quickly, like this one little change. Because if insurance would pick up the tab, they would save so much money so quickly on prevention. But I think that's where it is. Let's get a diagnosis of endothelial dysfunction that we can apply a billing code of 1 hour of ECP against it and let people get reimbursed for this. Because then we know the access points are going to come up because people have insurance. They're going to want to use it for this stuff. And then we'll have an ECP center every 30 minutes across the country. And you watch dementia go away. You watch heart disease significantly reduce. So many less strokes in this country.
Yeah. Nice. So maybe I lied. Let's say just last question. What do patients and clinicians take away from your story after they heard it today?
Yeah. One, challenge the system. It's good. Patients, don't be afraid. Providers, welcome that conversation. My son's about to graduate medical school. I tell him often, I say, my opinion, the best thing you can say to a patient when they ask a question, if you don't know the answer, is I don't know. Our follow-up should be, I'm going to try and find out, but don't be afraid to have an open mind and encourage your patients to force you to grow as a provider, as a clinician, because that's how we'll know you better. I would love for everybody to have crystal clear understanding of EECP and the benefits it can provide them, but that might not be realistic. So if you just keep an open mind, go to eecplocator.com. It's filled with educational material and other provider resources and clinical resources sites. I've tried to break it all down for everybody so they can really see how, if I say it works for dementia, why? I've got handouts under that what conditions providers are treating for section, which is towards the bottom of that patient resources page. But I've got easier to read documents that walk people through the why. And it's not Jack saying, it's this study saying, and then it's comparing like normal treatment with what ECP is likely to do for you. So I think people can just noodle through all that. But at the end of the day, like I think we're agreeing, like, it is about blood flow. the optimized blood flow, like so much else just solves itself.
Yeah, agree. I love this conversation. And then if people want to find out more, I think we mentioned a couple of resources already, but let's reiterate them. Where can people go to find out more about you and what you're doing?
Sure. Yeah. So EECPlocator.com is what I built to try and solve this access issue. And if nothing else, it's not invisible anymore because you can see the problems. I've got really good maps for getting your faces so you can find where your closest provider is. And I'm also grading the providers, trying to get traditional cardiologists mostly, but any providers that listed as, hey, we should use this after we've given you 17 stents and 5 bypasses. And we got nothing else for you. Then we'll let you use EECP. That is a bogus presentation of this therapy, and I'm tired of it. I'm not willing to stand for it anymore. So I'm grading those providers with a D. If they don't like it, they could do something about it, and they're going to keep their D rating on EECPlocator.com. I'm not budging on that. And, really try to push the conversation so that they understand that there's all these other conditions for it. And if you are going to only use it for cardiac, you certainly shouldn't use it last. That doesn't make any sense. And if you at least use it before bypass surgery, you get a C. If you're open to all these off-label conditions, we'll give you an A or B depending. But anyway, so you can navigate all that. And, I'm hoping, and I am seeing some new providers popping up on a regular basis. That's really exciting. So if there isn't anybody there, look back. But also I've got this business model I'm putting forward called EECP Pop-Up Clinic. And so that's just, go ahead and put your name in and say, I'd like you to bring this therapy to me. If you do that, I'm going to try and figure out how to make that happen. I don't have all of the logistics solved yet, but if we aggregate access demand, I know we can find providers for it. I'm certain about that. And I will do that legwork if people just come on the site and tell me, hey, I'm really interested. And then I've got a travel for treatment section, which is saying that you can go, there's at least one place you can go and just stay there right next to the machine and knock out what would take you 7 weeks. Normally you can do it in 2.5 weeks because you can do 2 a day, 7 days a week. Put new providers whenever I can find them or they present themselves. I'm leaving no stone unturned. I've called all the Medicaid providers that have billed Medicare ever for EECP. And I'm saying, do you still have a machine? Are you still doing this? Even if you don't have a website, I want to make sure your patients or potential patients know about you. So it is designed to be really comprehensive. And I wrote my book, EECP, the most underutilized therapy in medicine. You can go to EECPbook.com. I'm going to release that towards the end of May. So it should be available for everybody by the time this podcast comes out. And again, that's EECPbook.com.
Very exciting. I am so glad that there are people like you in the world with this amount of passion for making things better, especially in healthcare. So thank you so much for the conversation. I really enjoyed it.
Yeah, thanks for having me. This has been wonderful.
Thank you for tuning in to Taking Healthcare by Storm, Industry Insights with Quality Insights Medical Director Dr. Gene Storm. We hope that you enjoyed this episode. If you found value in what you heard, please consider subscribing to our podcast on your favorite platform. If you have any topics or guests you'd like to see on future episodes, you can reach out to us on our website. We would love to hear from you. So until next time, stay curious, stay compassionate, and keep taking healthcare by storm.